Naegleria, so high yield and you have to know it. It causes a primary amoebic meningoencephalitis, abbreviated as PAM, P-A-M, PAM. Now, PAM is rapidly fatal. It presents with a severe prefrontal headache, nausea, high fever, altered sense of smell, and again, it's often fatal. Now, in the clinical vignette, it's high yield to know that it's transmitted by freshwater lakes. So the patient will often have a history of swimming in a freshwater lake, and it enters via the cribriform plate. Now, it's diagnosed by looking specifically for amoebas in the spinal fluid. And I really can't stress it enough that in the clinical vignette, the patient is often a healthy adolescent or adult diver. Now, how do we treat Naegleria? Well, remember that it is indeed rapidly fatal, but it has been reported that in a few cases, amphotericin B, that's AMP-B for amphotericin B, has been effective for a few survivors. So, AMP-B effective for a few survivors. Don't forget the mechanism of action of AMP-B. It binds ergosterol, which is specific to fungi, and it forms membrane pores, which allow for the leakage of electrolytes. That's the mechanism of action of AMP-B. There are definitely some side effects of AMP-B that the student needs to remember, like nephrotoxicity, causing hypokalemia and hypomagnesemia, fevers, chills, hypotension, arrhythmias, anemia, and IV phlebitis. It's important to note that hydration can reduce the nephrotoxicity and that liposomal amphotericin reduces the toxicity. AMP-B can also cause red-green color blindness along with ethambutol. Definitely some side effects and toxicities that the student needs to be aware of. That wraps up all of the high yields I have to say. Don't forget that Naegleria can cause a rapidly fatal primary amoebic meningoencephalitis. This presents with a severe prefrontal headache, nausea, high fever, altered sense of smell, and it's often fatal. It's diagnosed by looking for amoebas in spinal fluid, and it's transmitted by swimming in a freshwater lake, so look for that in the clinical vignette. Also, it enters via the cribriform plate. That can be a question. How does it enter? Via the cribriform plate. The patient is often a healthy adolescent or adult diver in these lakes, and though often fatal, AMP-B has proven effective for a few survivors. A little tie-in, AMP-B binds ergosterol, which is specific to fungi. It forms membrane pores, which allow for leakage of electrolytes, and there are definitely some side effects that you need to be aware of, especially nephrotoxicity, fevers, chills, hypotension, arrhythmias, anemia, IV phlebitis. Definitely some side effects to be aware of. That wraps up everything I want to say. Naegleria, you definitely need to know this for step 1.